Okay, so hi everyone. My name is Loïc. I'm a medical doctor in anesthesiology and intensive care. And at the same time, I'm a data scientist. I learned how to code during my medical studies. So that make an interesting combination. And currently, I'm the CEO of Galeon. So I will tell you a story, the story of Galeon. And so 10 years ago, I was working in medical AI when it was not a buzzword. This time, nobody cared about it. So I started to dig on the database of the hospitals. And unfortunately, those database was really in bad quality. The data was unstructured. And it was impossible to train medical AI thanks to those data. And the doctors need to share information among hospitals, and it was almost impossible to share information between hospitals. So the system was completely broken, and the only solution was to rebuild the system. So the system of patient file at the national level. So 10 years late, 8 years ago, I started Galeon in this in mind. So, okay, we have to rebuild the tools for the doctors at the national level. At this time, I was in Sweden. I was working with the guys that made the national patient file in Sweden. And I came back to France to build the new generation of the national patient files. So with the help of hundreds of doctors, my colleagues, I went to see them, and they helped with asking nothing. We started to build a new generation of electronic health record at the national level. So it took 5 years to build it, and after 5 years, we started to deploy in some hospitals, and unfortunately, COVID came. So suddenly it was a full blackout. All our new clients were focused on COVID, and we were in the middle of the death valley for startup, when you don't have any more money, you have a product, but your clients don't answer. So we survived for this COVID, and after COVID, we faced another issue that was hypergrowth. So suddenly, all those hospitals that didn't want their data in the cloud, they wanted their data hosted in there locally. Suddenly, they realized that they wanted cloud solution, they wanted shared patients, they wanted innovation, they wanted AI, and they wanted research. And what they had, they couldn't do it. So they had to have other solutions. And suddenly they came to us and say, okay, we need your solution now, and we need it now. So at this time, we were 5 people, and we had no money. So we have to innovate again and find a new way to finance the project. So we gamified the investment in a startup. So we raised, and we made an ICO with a crypto. And we raised $15 million with 40,000 people 2 years ago. It was the biggest ICO in Europe. And all those people was caregivers, innovators, pioneers, like normal people. So we had no VC. And it was a choice to keep the independence of the company because we host so much healthcare data that a lot of big actors are really interested in this kind of information. So after the ICO, we started the hypergrowth. So currently in France, we have 16 hospitals that use the Galeon platform. So we host 1 million patient record that is shared among those hospitals. We have 10,000 caregivers that are using it. But the blockchain part was not only to raise money, because yeah, of course, it's quite interesting, but at the same time, we wanted to solve another problem in healthcare, is like trust. So if you want to train AI, you need a lot of data, and you need a lot of high-quality data. And those high-quality data, they are spread among many hospitals. And unfortunately, those hospitals have unstructured data. They're not in the same way. They don't store it. So you need to clean those data, and you need to get all those data in one place. And usually the hospitals, they don't want to give you the data. So ask a hospital to send the data to Google or Meta, you will see. They tried in the NHS. It was a big scandal, and everybody was angry, and for good reason. So we had to find a way how to bring trust in and training medical AI. And one way is really interesting in decentralization, and that's the heart of the blockchain logic. So why decentralization? You have the data in different places. If you structure it in the same way, you can train medical AI in a decentralized manner. So what it means, you take your AI, you train it in hospital 1, and after you train it hospital 2, and train it hospital 3, but the data doesn't move. It stays only in hospital. So in this way, you have an AI that is trained, but you don't have the company that had access to all the patient data. So it's what we are building right now, this network of decentralized science, and it's at the heart of the innovation of Galeon. And currently, we are based in France, but we are moving to Switzerland, the headquarters of the company, and we are in discussion with some country like Luxembourg, and to become the national patient file of those countries. So this is Galeon, and if you are interested, you can join the pioneers movement and become a pioneer. So you're welcome.
So let's see if we have some questions. In the meantime, I would like to ask you, why did you choose the ICO pathway rather than just a traditional fundraise?
Yeah, we are building a cathedral. So building a healthcare system for a country takes about 20 years. It's already 8 years. So it doesn't fit with the startup model with a VC. Usually a VC has to exit in 5 years. So in our case, we don't want to sell the company. So we had to find a way to protect the company to being sold. And so the investors that have the tokens, they can benefit from the value of the token, but they cannot force us to sell the company. So it was to separate the control and the money.
Okay, thank you. Another question is, how did you pen test your solution? How reacted the government regulators to it?
A pen test, that's a good point, because cybersecurity, it's a big challenge. Yesterday I was in Paris in a cybersecurity event. It's in France, it's 580 cyber attacks succeeded last year in hospital, so 1.5 per day. Galeon, last year we won 2 innovation awards at the CES for the hacker defense protection system that we built in a way. So we had 2 hospitals that had a cyber attack. They destroyed all the data on site, but the caregivers still were able to access Galeon by mobile phone, and so they didn't have to move the patients. Because when you have a cyber attack, usually you don't have electronic health record and you have to move all the patient to another hospital. And it was the first time that 2 cyber attacks where they didn't have to move the patient. So we are doing this security all the time, and we are pen testing the platform, testing with different white hackers, I would say, because yeah, we are attacked every day. So I think currently there's probably an attack on the platform. So that's the problem.
Thank you very much.